Hey there, welcome to All Things Sensory by Harkla. So happy to have you here. I'm Rachel, Pediatric Occupational Therapy Assistant, Certified Primitive Reflex Clinical Specialist, and a big time fan and finding some research that we can talk about that supports our profession, and more specifically, that supports the topics of interest, which a lot of it is sensory and primitive reflexes and just overall development. So today is going to be a little bit different for my fellow occupational therapy practitioners. I am going to just run through a few of my favorite articles that I think every therapist should have bookmarked. If your bookmark browser doesn't look like mine and it's just like boom, 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 all these articles, then it will now, hopefully after this. So what I'm going to do, I don't have any of these in a particular order. I just have accumulated a lot of these over the years and just put them into my little notes app. And we're just going to run through them and kind of do a high level overview. And then I'm going to assign you some homework so that way you can take the time to go back and bookmark these and review these and do what you please with these articles because they're fascinating. Now, there's a variety of levels of evidence, right? So really the goal here isn't to provide just one type of article. Like these aren't all systematic reviews. This is a variety of level of evidence when it comes to these articles. So just take that with a grain of salt as well. I just love finding these little hidden gems that support our work and that we can learn from and share that with our fellow therapists, with our clients. And I can't tell you how many times people have reached out asking for specific links to articles and, hey, have you found any research on this topic? And I just have, put it all in one place. So I'm going to share some of that with you guys here today. Let's jump in. Okay, first article is titled Effectiveness of Vestibular and Proprioceptive Exercises in Reducing Hyperactivity in Children with Autism Spectrum Disorder, a randomized control trial. Now, the highlight or the abstract here really just comes down to vestibular and proprioceptive exercises can decrease hyperactivity in children with autism or autistic children. Unfortunately, the verbiage in some of these articles isn't quite up to date, so just keep that in mind as I'm going through some of these. Vestibular and proprioceptive exercise training can assess the developmental progress, and such training positively influences the sensory profile development in this population. So you know that we're big fans of vestibular and proprioceptive input and activities, and this is just a great article to review in the sensory world. Okay, the next article is honestly a hidden gem, and I have referenced this article so many times throughout the years. It's called The Primitive Reflexes, Considerations in the Infant. Now, this is an older article, and it actually goes through different exercises and movements and strategies that you can do with infants as it relates to retained primitive reflexes and how to kind of proactively integrate them. So it's not only a cool article that includes additional research in it, but it also has pictures and diagrams and just lots of information if you are new to primitive reflexes or you just want to reference this in infants. This is a really cool article, and it's got some really great references linked as well. I will say that's how I find a lot of these articles is I will find an article and then I will scroll to the bottom and read through it. And then I'll look at the articles and the references that are linked in that article. And then it's just you're clicking on one article and then you're looking at those references and you're just deep down the rabbit hole of research. And that's how I found most of these articles is just through the deep dive rather than just searching for primitive reflexes in infancy. I very rarely will come across the types of articles that I'm looking for when I'm doing a search like that. It's more of a digging deep dive to find these specific articles. And typically I just come across them by accident, but it's a great accident. Okay, this is another one of my all-time favorite articles when it comes to potential risk factors for sensory processing challenges or sensory processing disorder. Now, this article actually has a table that breaks down different potential risk factors, and the research kind of dives into what specific risks are connecting to sensory processing challenges down the road. So from pregnancy, I've always talked about things like bed rest and prematurity and C-sections being a potential risk factor for sensory processing challenges, but this article actually talks more in depth about what the research is showing on those topics. So this article is titled "The Prenatal and Perinatal Risk Variables of the Sensory Processing Disorder." Again, this is a little bit of an older one, and it's from 2018, but it's still a notable article to just review in your spare time. This is an article from 2020, and it's called "The Impacts of Unstructured Nature Play on Health in Early Childhood Development, a Systematic Review." Now, for anyone who is in the nature therapy or outdoor OT world, any of that, this article is probably going to speak to you, or it's going to maybe light a fire under your bum in order to maybe go that route if that's something that you're interested in or you maybe have a passion for. I really love this article. Just, we all know how important nature is for sensory development and just like being outside and off of screens. But this article the goal was to conduct a systematic review examining the impacts of nature play on the health and developmental outcomes on children aged 2 to 12 years old. Now, really the breakdown or the conclusion of this article just talks about the positive impacts of nature play in terms of physical activity and cognitive development. Nature play stakeholders should focus on producing a universal definition for nature play, the development of standardized outcome measures, and the conduct of robust research designs. Implications of these findings suggest that the need for developmental of standardized guidelines to inform practice and policy in the design of children's play spaces in different contexts. So, really just identifying that there should be something a little bit more structured and standardized when we're creating these outdoor spaces and these nature opportunities for children. But this is a good read, so definitely check it out. All right, this next article is about primitive reflexes. It's from 2020, and it's titled "Primitive Reflex Activity in Relation to the Sensory Profile in Healthy Preschool Children." Now, I'm not going to read this whole abstract word for word, but basically it's talking about the presence of these active retained primitive reflexes or just retained primitive reflexes in healthy preschool children can be an expression of immaturity in the function of the nervous system. The main purpose of this study was to examine the types of sensory disorders noticed by the parents of children and if there was any accompaniment or any connection with the active or retained primitive reflexes. Now, this was a smaller study. This was only 44 preschool children aged 4 to 6. But my thought is when they do a smaller study like this, most preschool classrooms are going to have similar outcomes, if you will. My kids' preschool is probably going to have the same, level of sensory challenges or retained primitive reflexes as well. So that's kind of what I take from these smaller studies. But the sensory profile was determined by the child sensory profile cards, and the Sally Goddard tests were used to identify those retained primitive reflexes, which we love Sally Goddard. So that is super awesome. Now, the level of reflex activity was most strongly associated with sensory disorders such as dyspraxia, sensory vestibular disorders, and postural disorders at a specific level that you can dive into. And the results showed that the examination of non-integrated or retained primitive reflexes might be a screening tool for children of preschool age. So really, it just I don't want to say backs, but it just really supports the need for quickly screening and identifying retained primitive reflexes and sensory challenges in preschool kids, because then we can intervene and we can provide strategies in order to hopefully prevent or reduce future learning and academic challenges. All right, another interesting article. This one's more specifically about sensory processing disorder, but this one is from 2021, and it's called "The Relationship Between Sensory Processing and Quality of Life, a Systematic Review." If that doesn't tell you everything you need to know in the title, I don't know what will. But definitely take a look at this one. This one was really fascinating to understand how impactful the sensory system is and how impactful it can be just on an individual's quality of life, whether we're talking about kiddos, whether we're talking about adults, and how important it is to identify those sensory challenges. Now, the next one, I am a huge advocate of natural lighting and removing fluorescent lighting, especially in the classrooms whenever possible, or at the work environment. I mean, we had to change all of the lights here at our office in order to reduce the amount of fluorescent lights that we were being exposed to because they can be so harmful. But this next article is titled Lighting and Discomfort in the Classroom, which is super fascinating to me. This article is from 2009, so it's a little bit of an older article, but there are other ones that are similar if you, again, just go down that deep rabbit hole. But the goal is to identify light and its impact on learning and just helping kids be as successful as possible, whether we are adding colored glasses or colored lenses or like overlays onto paper, reducing lighting, outdoor time, all of that goes into just overall nervous system regulation. Now, the next one, I actually found this as I was writing my book, because one thing that we say so often is, proprioceptive input is generally well tolerated. It's generally not overstimulating, right? And so as I was writing my book, publishers were like, we need a reference for this. And I had a really hard time finding like a very specific place where this has been found and where I can show evidence. And I actually found some really cool things in this specific article. It's called Proprioception, Emotional and Social Responsiveness in Children with Developmental Disorders, an exploratory study in autism spectrum disorder, cerebral palsy, and different neurodevelopmental situations. And this one is from 2024, so it's definitely a newer article, but it's a really long article, and it's cool that you can read through the entire article. There's no paywall or anything like that. But it really dives into how beneficial proprioceptive input can be. And it just kind of dives into the science behind proprioception. So if you're ever curious as to, why we use proprioceptive input so much, this is a cool article to dive into, as well as the emotional side of things as well and how that connects. So definitely recommend checking this one out and just kind of reading through it all, because it was awesome. This is another cool article kind of going along proprioception. This is about interoception. It's called The Emerging Science of Interoception, Sensing, Integrating, Interpreting, and Regulating Signals Within the Self. Now, I can't speak for anyone else, but I can speak for myself that when I was in school over 12 years ago now, I never learned about the interoceptive system. I never learned about, that sense. I barely learned about prop and vestibular. And this has all just been newer information over the years that has come out. And it's cool that there is more research happening now and just more work in terms of interoception. And this article, I think I said it was 2021, but it talks about interoception and the science behind it, as well as just some helpful information of identifying it, how it works, some of just the mechanisms behind it. So definitely recommend looking into this article as well. Okay, this next article I am absolutely obsessed with, number one, because it's really fascinating in regards to primitive reflexes, but also we got to interview the researcher on this article. So jump back. We'll link to our interview with Tessa Grigg. And we talked, oh my gosh, it was such an incredible interview. She's amazing. And she broke down this article for us in depth. So we'll link that in the show notes for you. So that way you can make sure that you listen to that full interview. But this article is called Primitive Reflex Integration and Reading Achievement in the Classroom. And this one is from 2023. And again, it just kind of breaks down primitive reflexes in the classroom, and I'll just kind of high level the results here. The conclusion showed that post-intervention that the interventions group reflex profiles were lower, which is what we want, than the controls by a statistically significant margin. Reading scores increased significantly when the movements were used 4 or more times per week. It was also noted that the reflex scores for this group of children were higher than expected and higher than that of another group of New Zealand children. And we actually talked about why this was. And with this group of children in the research article, they were most of them were in utero when a really traumatic and really scary earthquake hit New Zealand. which you think about stress during pregnancy, how impactful that is on primitive reflexes and sensory development. So that was really fascinating as well. But the conclusion was decreased retained primitive reflexes, improved reading scores, and teacher comments showing general class improvements, which suggests that there is benefit in using movement-based reflex integration activities within a classroom setting. It's just so good. It's just so good. So if you take away any of these articles, please read this one and please listen to that interview with Tessa Grigg because it's so good. Okay, this is another really, really great article. It's called Attention Deficit Hyperactivity Disorder is associated with asymmetric tonic neck reflex, primitive reflexes, and a systematic review and meta-analysis. So this is really a high-level research article that discusses the connection between ADHD and retained primitive reflexes. I have extensively reviewed this article in courses that I teach. It's just a really cool article, and it just shows the connection between retained primitive reflexes and specifically symmetrical tonic neck and asymmetrical tonic neck with ADHD. So the conclusion, I'll just briefly overview this, is ADHD symptoms in children are closely related to non-integration of the ATNR and the STNR. Primitive reflexes, longitudinal or experimental studies should be conducted to review the causal relationship between ADHD and primitive reflexes in the future, which is just so fascinating. And if you're going through this article, what's really cool is that it actually has like this whole section of where it talks about like the ATNR is mostly connected to behavioral challenges, or the STNR is mostly connected to low self-esteem, or like there's lots of different components of this article that explain which reflexes are related to which areas of challenge that we're looking at. So the full article is linked so you can review the whole thing, but highly recommend reviewing this article. All right, another hot topic is whole body vibration. I did a previous podcast episode on that. I've done a YouTube video, so we'll link that. I've done a course on that as well. And I just wanted to pull one article from that because really the research is pretty limited when it comes to pediatric populations, but there actually is some emerging research. This article specifically is from 2023, and it's called Effectiveness of Whole Body Vibration in Patients with Cerebral Palsy, a Systematic Review and Meta-Analysis. The conclusion of this article found that systemic vibration is the most effective intervention to improve the balance and gait in patients with cerebral palsy and improve the body structure and function according to the ICF. So, really fascinating. Again, you can go down the rabbit hole. I have tons of articles on this, but again, full body vibration is a really cool strategy when used safely and effectively for the pediatric population. Okay, this next article is called The Influence of Pregnancy Risk Factors on Patterns of Sensory Processing Disorders and Motor Development. Now, this one's actually from 2025. And the reason why I love finding these articles is because I personally love just increasing awareness, right? Primitive reflexes, sensory development, like that's not typically on someone's radar unless you're in the field or you know someone's in the field and you can like talk about it. But my goal with sharing these articles is that if I can share these with you, or if we can, collaborate on these, hopefully we'll be able to share this information more with the people that we work with or on social media or wherever we're promoting this information in order to help people understand the connection between, pregnancy and delivery and how that can impact a child's sensory system. Not to freak people out, but to really just increase that awareness of like, oh, I didn't realize this is what I was struggling with or what my child was struggling with. That makes sense. Let's connect the dots and then we can create a plan going forward. So I love these articles because we're learning more about the potential cause and risk factors for things like sensory processing disorder and sensory processing challenges, motor development, things like that. And then we can proactively support them if we know that there has been any of these risk factors that they've gone through, or they've experienced. So definitely check this one out as well. This is another really fascinating article, and it is from 2025 called Selected Variables of the Risk of Sensory Processing Disorder. So again, talks about potential risks, things to be aware of. Again, spread this information far and wide. All right, this is another one of my all-time favorite articles by Sally Goddard. If you don't follow her work, please, please, please take a minute, read her books, follow her work, read this article. It's called School Functioning of Students with Neuromotor Immaturity. This is from 2020, and it really does a great job of talking about potential causes for retained primitive reflexes and how we can really address them in the classroom and what we're seeing in the classroom with kids who have neuromotor immaturity, retained primitive reflexes. It cites a lot of older data and older research as well, which is, I think it's really important to have those conversations and to make sure that we are identifying those, because this is stuff that's been around for a long time. One of my favorite little parts from this article that I always refer to is this sentence, and it's from 1963. C. Delgado revealed students with learning difficulties in his research had not passed through the stages of crawling on the tummy or creeping on all fours in infancy. So fascinating. That's why crawling is so stinking important. So definitely soak this one up, read it, review it, refer back to it always. This is another primitive reflex article. Obviously, I love this topic, but this article is called The Association Between Learning Disorders, Motor Function, and Primitive Reflexes in Preschool Children, and it's a systematic review. This is from 2022, so it's definitely a newer article, but a very good one to review and just to dive into. So definitely check this one out. All right, this last article that I'm going to link to is from 2019, and it's titled Effectiveness of Pediatric Occupational Therapy for Children with Disabilities, a Systematic Review. Now, I wanted to include this article because it really breaks down a lot of the OT interventions that we're using, a lot of the OT interventions that we are referring back to and we're researching as well. And it actually talks about the research and the interventions and, what we should do with certain ones and what we should do otherwise and what was included. I'm just going to throw a few of these things out there that it reviewed, things like parent education training, neurodevelopmental therapy, positioning, pressure care, self-management, sensation training, sensory approach, sensory integration, sleep interventions, social skills training, treatment and education of autistic and communication handicapped children, therapeutic listening, treadmill training, visual motor interventions, weight loss, and whole body vibration and yoga. So it really covers a lot of different areas and a lot of different treatment interventions, which I just think it's so fascinating to dive into some of those. So take a minute to check all of these out and just go through them. Hopefully you are a therapist who is always searching for new articles to dive into, whether they're new or whether they're a little bit older. I think that we can always take something impactful from these articles. But if you have any of your favorite articles or articles that you'd love us to review or to include, please tag us, send them to us. We'd love to share them. And I just think that it's a really fun topic. I don't know. I think it's fun. Hopefully you guys think it's fun too, but I've had a great time. If you have questions, if you have thoughts, comments, concerns, we welcome open conversations here. You know that, but let us know your feedback. And if you liked this type of podcast episode, let us know as well so we can do more things like this. Make sure that you leave a review wherever you're listening, Apple, Spotify, leave us a comment on YouTube, and we just appreciate you being here, and I'll plan on seeing you back next week for another podcast. Bye.